funding the entities with HIV and tuberculosis? How will that help?
What clause? Clause 8? Okay, well, the issue is, in your paper, you suggest that you form the Youth Global Fund and you form another group. The idea is that the Global Funds only address these impacts. There's already money in there. So the expand approach, you can reduce all the extra legislation, create a new body, all the extra costs, all the extra investments, and just have the costs that are already in this body spread out to include entities as well. And that's the most efficient way to proceed with this initiative.
Greece.
Clause 7, Part A, representatives from relevant NGOs. Draft resolution banking has been sponsored exclusively by Oxfam, Red Cross, Red Crescent, and Care International. Have any NGOs agreed to cooperate with this resolution yet at all?
Well, we haven't necessarily contacted the relevant NGOs. Discussions were had with Oxfam on topics such as this, and it was agreed on that collaboration with government in this sort of council would be something that would be under the purview under the implied operations of the NGOs.
South Africa.
South Africa is a little confused as to how you try to limit bureaucracy when in clauses 1, 2, 3, 4D, 7, 20, 21, and 29, you call upon the creation or expansion of committees, councils, and among other bureaucratic
With structures like the UNMTDC, they're actually bodies underneath the WHO where they'll be used to direct funding into areas that we feel necessary and that they feel will effectively combat the diseases. Rather than actually creating their own entities, they're just bodies underneath organizations that already exist.
In addition, one of the big differences, we do not create several bodies, we put them all under one.
UAE.
Can you speak up, please?
In Section 25, the resolution allows us to necessary down. How will you define necessary and control the size of the down?
Okay, there was a typo. There's an updated version. For substances that both euthanized and necessary, it should just be euthanized when necessary. It's when the animal is suffering more than it's living, basically. And it would just, the idea is that they would spread more diseases than they could possibly contain. So the animal is untreatable, and it's probably going to die anyway. We would as well. This, of course, is with respect to cultural responses toward these issues, and it's just a recommendation that most people plan instead of having them run around hunting.
New Zealand.
In Clause 15, it states that countries take preventive measures to inhibit entities by strengthening health systems. However, it is a difficult idea to achieve for nations with limited support. How will nations with underdeveloped economy and government create national healthcare systems?
So this is a situation.
Only one person.
Okay,
So basically, we mentioned a couple initiatives here that work with developing countries. So it makes it really easy for them to access these ways to strengthen their health system, prevent NTDs, and just make an overall very effective way to basically combat the issue through some sort of healthcare system strengthening. If that answers your question.
UK.
Thank you. Again, operative clause number 20, you insinuate through part C that in providing proper treatment to those traveling while ill, you will be checking their medical history. Now, for all members of the European Union, I understand this isn't binding, but in supporting this, are you aware that this directly violates the European Union stands on the rights of the privacy of the individual? And can you expound on why you're not recognizing the difference between an immigrant who is settling into a new destination or one who wants to visit a country for vacation?
Well, the logical fallacy in your argument is you're stating that we're all assuming that providing proper treatment to those who are traveling while ill assumes they're going to check every single person. That is false. We're not going to do that. If you go to Japanese airports, they have guards standing there watching. If you have a fever, you walk through a mat and they check your shoes for any bacterial issues. And this doesn't mean that we're going to go and ask them for their entire medical history, considering that many people don't even have medical insurance. So the bottom line is we're not going to do anything that's extremely severe. The recommendations, and they're only going to help. Your assumptions are completely invalid, and it does not violate any of our policies either.
That concludes our question and answer period.